our guest, Mehraveh, and from Iran. Mehraveh, thank you so much for joining to this meeting. And Mehraveh right now is the head of the COVID center in Iran of from university. But probably, Mehraveh, you will share a little bit more and introduce yourself in the right way.
Uh, okay. My name is Mehraveh Sadeghi, and I am a medical doctor, and I work in Iran as a general physician, and I was the head of COVID-19 center for 2 years, which from since the COVID pandemic is announced, and we work under supervision of Qazvin University of Medical Sciences, and that's it.
Awesome. Mehraveh, thank you so much. And first of all, let's talk about your background, just for understanding for a broad audience. We are a non-profit organization going to do, and actually the mission of our company is to reduce the mortality rate from heart attack. And it's the reason why we have a bunch of and a lot of interview with the guys from medical area to deep dive to this aspect. How did you choose the medicine area? Why the medicine area? Is it popular in Iran or maybe family story? How it was?
Since I was a child, I was familiar with the medical area because my parents both work at this area, so it was really familiar for me, the staff and the knowledge and everything. And I can say from the beginning, I like to help people. This is my goal, I think, in life. And I think as a medical physician or as a doctor, you can help so many people, and it does not matter how old are they, how is their sex, their region, their region, their color. It is not important, and the goal of you is helping them and ease their pain. And I think it is a really good reason to become a doctor. But in contrast, the self satisfaction that we have in our job, we have really dark areas that we have to say to the patient or their families that we cannot do anything, and it is the end. And it is really heartbroken for me. But that satisfaction that we have, it is kind of addiction, and make you really happy. So I decided to be a doctor, and I love medical computer sciences too. And I see in all parts of the world, we don't have so many clinicians who knows the computer and who knows the AI or some project like that. So I think about it, how it's going to be happened. Sometimes maybe in the near future, I can help as a clinician in the computer sciences things and AI. AI nowadays is really a hot topic, but in medical area we cannot use it very. It is not really developed in the medical area, and I think we can have really great ideas for that.
Cool. Thank you so much for sharing this behind motivation and the points which you bring you to the medicine area. And speaking of all your activities, why did you choose the Qazvin University of Medical Science? Uh, is it the local university in the Iran, or this is like I don't know, maybe this is a international university which have a connection with the different countries? Why it was, or maybe you live in near this university?
You know, accepting a Qazvin University of Medical Sciences is not by choice. You know, I don't know how familiar are you with Iranian educational system.
I'm very
If
curious, and if you will bring some thoughts
okay,
about this, yeah, it will be very
okay,
interesting.
okay, I will explain with you. I will explain.
Okay.
Uh, okay, you know, I must have started from high school. When you were in high school, you have two choices. You can choose mathematics division or medical division. I chose medical. And then when you graduated from high school, you have a diploma. Yeah, like we called it medicine diploma.
Mm-hmm.
When you got your diploma, you have to compete with too many people for it means for university entrance exam. Okay.
Mm-hmm. Mm-hmm.
When you take your exam, you can choose your division in medical, dentistry, pharmacy, and anything, which is really competitive. And it is based on scores. The
Mm.
score that you got, and that's only one exam.
If you have a good scores, it's your ticket to the studying,
Yeah,
learning and studying in university, right?
yeah.
Okay.
If you know, in this competitive test, every year between I think 600,000 students, six
Wow,
hundred thousand
it's a huge
or
number.
yeah, 75,000 students take this exam, and just only 1,800 can no 1,000 can go to the medical field.
In other words, you went through the very, very high competition between the
Yeah,
students over the all Iran, right?
yeah, yeah.
Cool.
That's it. And you know, it is not just that. We have many Quras here, Quera, I think, that which 60% of it uh, is for people who are veterinarian and their children and their relatives,
Oh, some
and
social
maybe
programs, right?
yeah, and most and the and governmental affiliates and their children.
Oh, so the
This is
government
60%
support
for them.
these children. Mm-hmm.
Yeah, it remains only 40% for the for us. Like we don't have any quota, and we must compete with others, and that's it. Uh, that year, when I took my exam, uh, we our government suddenly took a really I don't know how can I say it is bad or not, but it's not good decision for women, especially for women, because before that. The previously, I mean, 50% is for girls and 50% of capacity is for boys. But at that time, our government decided to decrease the capacity for girls, which
Change this
means,
proportion. Yeah,
yeah,
it's an unbelievable point for the America, you know. But it is what it is, right? And
yeah,
from this point of view, I'm sure that you decrease options which you have to choose the university, and at the end of the this story, you went to the Qazvin University
you know,
because you don't have. Yeah.
that's it. We girls, quite free quite girls, have just we have just 12% of all,
Wow.
and it is really hard. My goal was Tehran University of Medical Sciences because I think it is really bigger university and it is a known in all over the world. Uh, but with this decision,
Yeah.
I cannot make it. And this is
Yeah.
just one time decision. So I decided to stay in Qazvin, which is near Tehran. And I can use the educational facilities and all the things in Tehran with a really short distance.
Wow. It's incredible. It's like a smart move when you find a way how to go through any government restrictions, other things, and you get things done, right? And
Yeah.
it's awesome. It's awesome. And
Yeah.
uh, you know, uh, this is very interesting things of university. But actually, when I discovered your profile before, I found that you was involved in a part-time job or family
Yeah.
medicine physician.
Yeah.
What is this and how it works in? Could you share this
Yeah.
yeah experience?
You know, but this is one of the other things that we have just in Iran. As a medical students, we use the free educational system here. When we start our program, we obligate we commit to the government that we work here. Depend of our score. The score is better. The time is shorter. Serve to our country for 6 to 18 years. But the second year, uh, the first 2 year is obligatory for all of us, and we cannot attend to any residency program. We cannot do anything, and we must work for government with the lowest salary, and everywhere they decide for us. Uh, so um, I start my period, 2 time period, but it is not enough, and the work there and the salary it is not enough. So I tell them I need to work in another clinic and private clinic. And they said, okay, you can, but if we need you anytime, anywhere, you must live there and you have to say to the clinic that you are working because I am a medical doctor, I work as an emergency physician actually, but I do the family physician too. So that's the story of my first
Awesome,
part-time job.
awesome, awesome. It's incredible how you not stopping on all these things and how the government has some
Push
interesting
us.
obligation. I remember during my time, it was the some joke, and we are were software developers, and one of the men came to us and asked, "Hey guys, do we have a strong software developers?" And for sure, the reason why he asked us was not to make a very nice software in the world. For sure, we need to get some boxes with the trash and go to. And, uh, anyway, you have this first part-time job. Actually, this was. Not super interesting, not super paid job, but it was something, right? It was the first experience in the real world. Uh, yeah. Uh,
I at that time that was a COVID pandemic, and I like to help people, and I worked in a COVID center too, and I have new information about the COVID. So if I work as a part-time job in another clinic, I can help people there too. So I think it can be a really good and a smart decision to go there
Yeah,
because I can have really experiences and achieve them and become a better doctor.
yeah. And speaking of your work in a COVID center, could you
Mhm.
share how it is in your university and what is your responsibility? What is how many people involved in this and how it's going during this 1 2 year? Because I'm sure that this COVID center, this something is was made on the fly, and yeah, any things related to your work in COVID center?
Our COVID center, it was a governmental COVID center, and it works for 16 hours a day.
Wow.
Uh, yeah, from 8 in the morning till 12 in the midnight. Yeah,
Yeah,
midnight.
yeah,
During this time, in Iran, we have too many pickets of COVID. So we have too much patience. I remember many days I visit more than 200 patients a day, and it was really exhausting. Uh, but we think about it and plan. And uh, they used other countries' plan and how their centers work, and they design some local plan, and we worked from that chart and protocols. The PPF protocols are the same in anywhere. We have there too. But how the center works is like it is a outpatient center. So the patient who doesn't have a severe condition came there. They are a mild condition, and yeah, they came there to the center first to go to the receptionist. They took them, and then they go to the nurse.
hmm
The nurse, which placed their write something for us, like the recent exposure for the patient, if they have a recent exposure with the COVID infected people, and about their vital signs and something like that. And then, if the patient is suspected to COVID infection, they refer to the physician.
hmm
Uh,
hmm
when patient come to us, we checked patient, take a physical exam and medical history and all the things they are routine in the medical doctor's visits. We do all of them, and if they have the criteria that we taught, we can perform for them PCR test. And if we are really we are in a high level of suspicion that he
Yeah, yeah,
or
yeah.
she had the COVID-19, we told him or her about how they must be quarantined and the prescribe some drugs, and if they have a severe condition, and some people like COPD, they had a COPD in their background, or maybe they had asthma, they can understand how dyspnea they had. When you took their auto saturation, you be really surprised that they are really in danger, but they don't know. And we have an ambulance and other things that we can refer them to the hospitals for
hmm hmm
further things that they need to be done for them.
Awesome, awesome. Thank you for sharing this experience. How it is, how it works in your university in your country. And I heard that in these COVID centers around the world, there is some let's name it, some correlation to the heart failures. In other words,
Yeah.
in COVID centers, at least at the beginning of the COVID, it was the real dependency on the people struggling with the heart attack and with COVID. And your thoughts or your observation on this? Do you see a lot of people? Yeah.
Some of the risk factors of heart attacks, one of them is hypertension, and the other is some diseases that people have. The most important is COVID virus goes to our receptors, our ACE2 receptors. ACE2 receptors, which the receptors that we made medicine for them in patients who have hypertension. So when COVID goes there and take their places, and the receptors full, the drug that we use for that patient, it's not work. So the incidence of heart attack raised. And the other thing is in the patient who has respiratory chronic respiratory conditions, they don't understand the lower side. Their body, because their body is I forgot the word. Their body is adapted with the
they adapted to all this
adapted with with this lower oxygen, so they cannot understand that. So the oxygen that their heart need decreased. So the incidence of heart attack can increase.
Got it. Thank you so much for this explanation about dependency of the heart attack and the COVID. And my next question, we smoothly started our main topic about heart attack. On your personal opinion, I'm sure that you knew a lot from the medical knowledge and experience, but for your personal opinion, why do so many people have the problem with heart attack? What do you think?
I think the most important thing it is acute condition, and the risk factors that we talk about in the heart disease grows through the years, and the patient don't notice them, and some of them, like family history, like obesity, like hyperlipidemia. These are not things that people really care about. They care about the things that they see. You told them your heart, you maybe you can have a heart attack, but they say, "I'm okay now," and it is their symptoms are different from person to person, and maybe it can be a really small attack, and these small attacks then become too many. They can make a neglected MI or something like that, and at that condition we cannot do anything for the people.
Yeah, absolutely agree with you and your points on this. But can you share some specific for the Iran? What's the situation with the heart attack in Iran in general? From your what you see?
A heart attack, it depends on many risk factors. In Iran, some of the things, I think some important things that we grow the heart attack is stress. Our people our people have too much stress, and stress is one of the most important things in the I think in the heart attack. It is not important in other countries, in developed countries. They don't have these risk factors really important for them. I think the most important factor on that countries are obesity or lifestyle or hypertension and something like that. But in Iran, the most thing is heart is stress because it is really high, and most of the people that I see, they prefer to neglect their symptoms and work, and they say it is not anything, it's not anything, and when they come to the hospital, it is too late.
Oh yeah, absolutely. Because when they came to the cardiologist, cardiologist only can say that, okay, you are very close, or you had a heart attack, but actually it was the problem which started, I don't know, 10 years before, or maybe 15 years before. Yeah. And the stress is the main point
In
of iron
Iran,
problem. Heart attack. Sorry?
in Iran, we have some free plans for the people. We are screening hyperlipidemia, we are screening people for the diabetes and for hypertension, so we can control these things. We have all of our population under control in these areas. So when you have control in these areas, you must think about the other factors that happen to them. Why? Why, when you know who has the high cholesterol and let the drug and prescribe the drug for them, you control your all the medical things that we can control them, we do for the patient. So you must think of something that happened in their life that we don't have any control on that.
Mm. In other words, we can and we have tools, and we can have an understanding how to control the factors which decrease heart
Yeah,
attack. But sometimes we
yeah,
don't have a control of the people's life, and sometimes it's the
yeah,
reason why they still struggling with the heart attack.
yeah.
And you might mention this point about control, but I'm curious about what do you think of the role of the big insurance company, or maybe government, big organizations in all this fight of the heart attack? What do you think? Because I'm not sure about the situation in the Ireland, but in America, insurance company, this is a huge team player in terms of fighting with heart attack, and it depends on your insurance policy and other things. But I'm curious about the Iranian situation from this point of view.
Our insurance companies didn't work a lot here. And
In other words, probably government involved a lot in this, if through the medical institution, medical education,
yeah, all of
medical
them is governmental.
government, and how they work, and how they trying to prevent or maybe to fix this problem with the heart attack, if you know. Yeah.
We have some as you know, I work in a comprehensive center too. I was the manager out there, and I was the physician there. If we have too many plans and too many things for a heart attack, for a non-communicable disease, and in those centers, we have to work as public health affairs, and
Yeah.
yeah. Our Ministry of Health have some plans, and they told us about it, and we must do it in the population that we have on that area. And we have some plans like controlling we don't get money from the people when we do these things for them. We have to check their hypertension, and if they need, we refer them to the cardiologist, and if they don't, and their hypertension and their blood pressure is under control, we don't do that. And we must check their FBS, fasting blood glucose, and check cholesterol, HDL, LDL, and these things. There's really important factors in heart disease, because the little injuries to the vessel during the years can be really can be one of the most important causes of the heart attacks.
Yeah, yeah, it's true.
If you conditions like diabetes, like autoimmune diseases, like heart hypertension, and these things, if they are under control, you can decrease the incidence of heart attack. So we worked on these problems on our population. And if they need any checks, if they need any drug, we prescribe for them and follow them through the plan. And I think it is a really good program. But the problem is, because they don't pay the personal well, they didn't do it good and in effective way. In theoretical, it is a really good plan, but when they want to bring it to the working, they
Hmm.
cannot.
I got it. I got it. In other words, the government involved a lot in these checkups and diagnostic
Yeah,
things and procedures, and
yeah,
actually, the government provide for the population ability to check
yeah,
blood pressure, glucose, and other
yeah,
most
everything.
important things for the heart attack. But the problem is that the way, on the practical way, when this happens, there is some room for improvement in terms of efficiency, how to do it better.
So many room for improvement.
Yeah, yeah. My next question will be about the age, because we all know that right now the heart attack problem. This is a most of all problem of the seniors, right? But I discussed this problem with cardiologists, and they said that, and they predict that in the future this problem will be not only for the seniors. This problem will be for the adult and for the young generation as well.
Yeah.
And do you see some I don't know, examples that in our world when the obesity is a pandemic situation in terms of obesity? Do you see this
Yeah.
shifting with heart attack, with the heart problems to the young generation, or not?
Yeah, of course. And mortality rate in younger generation is really high, because the younger generation doesn't have any collateral vessels in their heart. So if the main vessel is blocked, their heart stopped from pumping. But
Mm,
in the older one, when we have the collateral vessels, the mortality rate is lower than the younger. So you see, we always are. Attending says, if you have a patient with a younger age, you must not um, have any doubt that he or she um, can be survive. They
I got it.
almost
I got
die.
it. Yeah, yeah.
Yeah. So the obesity is one of the most important risk factor, because when you have an obese patient, they have a high cholesterol, they have a high LDL, and they have a low HDL. HDL is a good cholesterol that we say it,
Yeah,
and when it gets high, when you do exercise, when you have some activities, so When it is low, we cannot do anything for that, and we don't have any drug for make to raise it significantly. It is just as a 2 or 3, and it's not good. And one of the other reasons is cholesterol plaques in the vessels. These cholesterol
Mm-hmm.
plaques can block the vessels of the heart, and um, they can be uh, deathful
Yeah, yeah,
for
yeah, yeah.
everyone. Yeah.
Thank you so much for sharing this. Thus, actually, we are very close to the our end of the interview, and my last question will be about the future. And try to imagine that you are minister of all resources, and you have as much as need money, and you have a brilliant students, physicians, cardiologists, all medical guys who you need to solve the problem with heart attack, and you have everything which you need. And my question is, what top 3 things which you will do to decrease heart attack?
First one is working. Uh, you know, uh, made my students and my young generation to have uh, new habits, new healthy habits. And we can start it from the elementary school. When they learn to uh, work out is good thing, and the feeding habit, eating habits. The first step I think is the changing the habit. I mean, changing the lifestyle. You cannot have a really um, impressive effect on people who are at the age of 40, 50, maybe sometimes, but you can have really great effect on the next generation when
Hmm.
they know the things. The children have the ability to learn really good things, and when it's become a habit for them, we don't need to treat it.
Yeah,
I think prevention is the first step. So we must work on our public health. We must educate people. We must have some plan for human brain see the short time effect on the life. When you see something, when you have some bruises on your eyes, you
yeah,
go to the doctor. What is it? What can I do with it? But when you smoke, the doctor told you when you smoke that it is really a bad thing, and in next 20 years you gonna have lung cancer, you can have heart attack, and so many things. But because we cannot see our 20 yet, and we cannot see the 20 years after. So we said, okay, that's okay. I'm okay now, and I feel it well, and I like it, so I do it. You know,
yeah.
uh, this is how to process.
Thank you so much for this
You're welcome.
incredible approach. Instead of the fixing the problem, work a lot with the prevention, education, and work with the young generation instead of trying to fix this problem with the seniors when the time was lost, and it's not easy to change this situation with the heart attack risk score. Mehraveh, thank you so much for all your ideas. Thank you so
Yeah.
much for your work, for your involvement in COVID centers. Thank you for your brave,
You're welcome.
how you go through on your own path in education, in medical, and that you are doing for this world so much. Thank you so much for the interview, for the time,
You're
and
welcome.
it was very, very, very pleasure to talk with you. And yeah, thank you.
Pleasure is mine.
Yeah.
I will.
Okay.
Okay.
Bye bye.
Bye.